Thank you very much, President. And I rise to speak to Ms Crozier's bill, the Mental Health Amendment Counsellors Bill. And, I don't think there's a single person in this chamber who does not passionately believe that a child's mental health is crucially important. And mental health support in our schools is very important. And, and I'm also clearly of the view that we should have highly qualified mental health support available to Victorian students. But I have to say I'm perplexed by this bill, and albeit I've only had we've looked at it over the last few days. I've read the second reading speech and heard Ms Crozier provide it. But this bill goes to amending the Mental Health Act. It doesn't relate to or touch on schools at all. It changes the definition of mental health practitioners for the purposes of the Mental Health Act. The definition of mental health practitioner in the Mental Health Act only relates to those who can make a mental health assessment order under that Act. If you read that Act, and I went through that Act this morning, that is what the definition for mental health practitioner relates to. And under that, this means that this allows the people who are defined specifically and directly in that Act to provide, to do assessment orders, to make assessment orders, which is the first step in initiating compulsory mental health treatment. A mental health practitioner under the Act may make an assessment order. An assessment order then enables an authorised psychiatrist to examine the person without the person's consent to determine whether they have a mental illness and need compulsory mental health treatment. An assessment order enables a person subject to the order to be taken to and detained in a designated mental health service for assessment if necessary. It's a really narrow purpose in this bill, in this Act, and it doesn't in any way relate to counsellors in schools. So I don't understand why we would add counsellors to that definition in the Act, because it won't actually help. It won't make the case for bringing more counsellors into schools, which I entirely support. And in reading the second reading speech, everything around the bill I support, but when we go to the bill, that's where it just doesn't make sense. And Ms Watt listed substantially where counsellors are in schools, and in fact where through student support services that are available through regional DETs. There's dedicated access for secondary students to counselling through Headspace. Primary welfare officers, who are often counsellors, operate in 800 or 1,200 schools. There's counsellors there already. So I'm still quite perplexed as to why we would want to define them under the Mental Health Act, and for some reason come to the conclusion that that would increase the number of teachers, a number of counsellors in schools. So the second reading says that by doing this, it will provide approximately an additional 2,000 counsellors. It won't. It won't make any difference. But I wonder, because we've just seen the announcement from the government that the Mental Health Practitioners Program, which has been announced, and I think Ms Watt also spoke to this, where every Victorian government secondary and specialist school will have funding to employ a mental health practitioner. And that's a very broad range, everything from therapy dogs to psychiatrists. And I wonder if that's where the confusion has come with this bill, that it was because of the term mental health practitioner in that announcement that it was thought that maybe it was only allowing those defined under the Mental Health Act as mental health practitioners to be able to become part of that program. But I do think there's an area where I am passionate about, and that is actually ensuring that we have qualified good mental health practitioners in our schools, that we have the right people to do the right job. And we need to weed out those that are deficient. You know, some of that support there is completely unqualified. And I think it'll come as no surprise to this House that I'm speaking about the chaplaincy program. You know, to become a chaplain in Victoria, you have to be a Christian, one. You need a Cert 4 in youth work or pastoral care, or even both. That's it. That's what qualifies you to become a chaplain, to provide student welfare in the schools. Now, the department's guidelines say that chaplains may be from any faith or no faith, and the chaplain's job and work is not meant to be religious. But you can't get a job as a chaplain unless you are religious. And not any religion. The chaplaincy program is limited by the providers of the program, and all bar one insist that they will only hire Christians because they can. So this is incredible discrimination apart from anything else. But, and I'd just like to also mention that there are chaplains out there who have got very high qualifications and are very good at their jobs, and I grant that. But when we're talking about wanting qualified people in our schools to provide mental health assistance to our students, then maybe we should be looking at where we're not providing qualified people, and maybe we should be reconsidering that. Because I think our children do deserve highly qualified mental health support now more than ever. But a 13-unit, one-year course in youth work or pastoral care is not it. That is not the professional qualifications I want for my children and to help support their good mental health. Now, yes, as we increase the volume of mental health support in our schools, we as a state should also increase the calibre of that support. And I would say that one way to do that is by cutting out the obvious deficiencies that place underqualified staff into the front line with our vulnerable kids. And that is getting rid of the chaplaincy program in this state. But again, I support counsellors in our school, and I certainly think that, you know, given the announcements and given the rollout of all of these new mental health programs, that we are going to see more counsellors, and I think that's a wonderful thing, and I will do it whatever I can to assist the schools in my electorate to access those programs. But I still cannot understand, and maybe Ms Crozier will be able to sum up and explain how amending the Mental Health Act to add registered counsellors to the definition of a mental health practitioner puts more counsellors in schools. It just doesn't. Thank you.